Welcome, everybody. We'll give it just a second as we have people hopping on. We have lots of wonderful people excited to hear our topic tonight. And Justine, our fabulous presenter. So welcome. Oops. You're upside down, you're sideways. There you go. Welcome, Gilbert.
Thank you.
Welcome, everybody. While we're getting settled in and waiting, why don't you guys in chat let us know how old your loved one is, or if you're a professional, if you could just let us know how old the people you work with are, just so we can kind of get an idea. Justine's got a great presentation ready for you guys tonight. And Gilbert, I'm going to go ahead and set you up.
Okay.
There we go. I saw Eric. Eric says he's a 23-year-old young man and has the gray hair, surprisingly, to prove it. Oh, 16. Okay. Hi, welcome everybody. We're happy to see you. We're going to give it just a second more. I can see we still have people on. Jessica has a 3-year-old. Eric, of course, I remember you, so welcome. Somebody who works with ages 16 to 25, 16, 29. Oh, wow, we got a little bit of everything. So it's great to see everybody. We're going to go ahead and get started. And I know while we'll have some people jump on later, we are recording this. So if you missed parts of it, and Justine has already said that she's happy to share the handouts because I know you guys are going to ask. So we will get the presentation and the handouts and the recording to everybody, hopefully tomorrow, because I know that's going to be important. Hola, good. 0 to 3. Oh, we got little thing. We got everything. Yeah, we got the babies and the adults. So welcome everybody. In case you don't know, my name is Beth Bird. I am the executive director for the Autism Society Inland Empire. I always say, more importantly, I'm a parent of a young man who's almost 30 with autism. I can't believe that time goes by so quickly. But we are happy to have another one of our local experts here to talk about social skills, which is so important to our population. And Stephanie says there's such a need for this. So thank you, Stephanie. We have a great night for you tonight, a great presentation. We have Sherman, and she's going to talk a little bit about her experience and her background. And I think that's it. I'm going to let you take it away, let you share your screen. I'll be here if you need me, and I'll be watching the questions, and we can stop periodically and see if we can get some of these questions answered. So take it away.
Thank you so much. It's such a pleasure to be here. Okay, so my name is Justine Sherman. I am a speech pathologist, and I have been in the field since 1998. So Beth, I feel you with it. The time has gone by very quickly. I moved to California from the East Coast, and I promised my parents I'd be here for a year, and that was 24 years ago. So I used to work in the schools, and I felt after a few years of doing that, that I wasn't able to do the type of therapy that I really got into this field to do, with that one-on-one therapy and a parent coaching model of getting to really know the families and interact with them during therapy. So I moved over to a private practice, was associate director for a practice in Sierra Madre, and then bought the practice, and that was in 2007. And now Justine Sherman and Associates has been in business for 15 years, and we have offices in Pasadena, Monrovia, and locally in Claremont here. We have about 25 speech pathologists working together, and we have many families with children on the spectrum that come to see us, and to that we can work with and really build a strong relationship with, and help navigate this world. Beth and I were talking prior to this starting, a few things I just want to say. One, I am a speech pathologist, and I do work with children on the spectrum, and I have worked with social skills for years. I wouldn't say this is my area of expertise. There are so many therapists out there that they are devoted specifically to social skills, but it's something I feel very comfortable with. And I wanted to make sure that you're getting information from a reputable source. And you'll see at the end of my presentation, I've listed all of my resources for you to go and check out for yourself. The second thing we were talking about, there's so many different points of views about therapy right now, especially with individuals on the spectrum, and whether we should be doing social skills therapy at all. So I want you to know that anything I say today is with good intentions and with the idea that I want you to keep in mind what is right for you and your family. There's no one size fits all with therapy. Speech therapy may work for one family. Sensory integration therapy will work for someone else, ABA, floor time, a non-ableist therapy approach. So it really depends on what you feel, what research you've done, and what is best for your family. And we're going to kind of approach it all today. I really want to make this more of a conversation than dry and me just reading out a PowerPoint to you. So please, ask questions. Beth will be monitoring, and I'm happy to stop and answer it, and we can have a conversation. Beth, is there a way, if we're asking questions, that we can see people's faces? Because I can only see your picture.
I know, unfortunately, you're stuck with me.
Okay. Okay. Talking about social skills, it's so much easier to have a conversation when you can see someone, but we're just going to wing it here. Okay, so I'm going to share my screen here. All right, and Beth, can you see the screen?
We sure can.
All right, everyone, so let's get started. So what I was asked to talk about today is called Social Skills Across the Ages, and just a brief review. So it sounds like we have all different ages represented today, so from our little ones of 3 all the way, up to 29 years old. And so we're just going to be talking about the developmental norms for social skills first. Let's get going here. So our objectives today are, we're going to define social communication skills, we're going to discuss social communication skills across the ages, and discuss how to help, different approaches. So when I was doing research for this, it was interesting of trying to tease out the difference between pragmatic language, social skills, social communication skills, because these are going to be terms you'll hear depending on who you're speaking to. ABA may say one thing, speech may say something else, a neuropsychologist will say something else. So what we're going to talk about today really is the umbrella term of social communication skills. And what that is, social communication is just this term that we use about everyday interactions and how we communicate with each other. And we all know that communication, that social communication, is really a vital part of the human experience, and it's how we connect with one another. And so with social communication, we have this ability to change, sort of to code switch, depending on who we're talking to. So with social communication, I'm going to speak differently when I give a presentation than when I'm speaking to my daughter, or to a complete stranger. Or I'm going to speak differently when I know you and I are on the same page with the topic, versus if I have knowledge that you know nothing about the topic, I will code switch and I will use different social communication skills. So those are just examples of what social communication skills are. It's also about following the rules of a conversation. And then we have pragmatic language. And so with pragmatic language, that's what speech pathologists say. We always say pragmatic language. So pragmatic language refers to social language skills that, again, we use in our daily interactions when we communicate with one another. And this is the conversational skills like our nonverbal communication. So our body language, sitting like this, we know. as neurotypical developing humans, that we may show anger like this, or gestures, this means hello, or eye contact means I'm engaged. Understanding non-literal language, which would be idioms, inferencing, humor, sarcasm, problem solving, interpreting and expressing emotions, all of that falls under pragmatic language. So when you think of pragmatic language, what I want you to think about is knowing what to say, when to say it, and how to say it. Sorry, I made this a PDF instead of doing it as a presentation, so I'd be able to easily share and jump between things. So I apologize if it's a little difficult as I'm transitioning between slides. So when I said that social communication was a umbrella term, it really is, because it is made up of these 4 areas. So we have social interaction, social cognition, pragmatics, and language processing. So you can take a look, make it a little smaller for you so it all fits in the page here, at all of the areas that fall into each item. So we have under social interaction that reasoning, the peer-related social competence, conflict resolution, code switching that I was talking about earlier. Under cognition, there's something called theory of mind, which is really being able to take someone else's perspective and determine how they're viewing the situation. Joint attention, inferencing, executive functioning skills. Then we have pragmatics, which I was talking about earlier, which is our body language, our facial expressions. What we call discourse, which is initiating a topic, maintaining the topic with back and forth communication, and knowing how to end a topic. And then we have the language processing, which is expressive language, which is what we're able to say. Receptive language, which is what we understand, and that could be both verbally and written. And then we have morphology, syntax, semantics, and phonology, which are all areas of language. Morphology are really the grammar of how to end words. So like an ed means a past tense, an ing means a present progressive. So those endings of words change the meaning of the words. Syntax is how we're ordering words and putting them together. Semantics is our vocabulary, and then phonology is language-based sounds. So all of these fall under that umbrella of social communication. So today, I just want to keep in mind, everything we're talking about just is under one of these areas, and it really doesn't matter which one when as parents we're thinking about social communication. So when do social communication skills emerge? When do we expect to see them? So these basic pragmatic skills will emerge at really a very early age. And we're going to go over that really between 0 and 6 months. But they're refined and they progress and they develop through pre-adolescence and then adolescence. So what I have down for you today, I just done lots of different research and pulled from different resources of developmental milestones. So again, I want you to keep in mind, these are approximate ages where we see this social communication develop. It doesn't mean it is exact, but in majority of 0 to 6 month olds will present with these skills. And how I want you to use this information is you can use it as sort of a checklist of, okay, I'm seeing this with my child, I'm not seeing this. This is something I want to address. It can help you with down the line IEP goals. It can help you work with your therapists and have sort of a voice in your therapy, which you always should be a collaborator in your therapy of, I have concerns about X, Y, and Z, or I have these milestones. What are you seeing that my child has, does not have, and how do we address it? So that's our thought. So I don't want to sit and read these all to you. So I'm just going to leave them up each time for about 30 seconds so you can read them. and then we can move on. What I think is really important for these first few ones is really at 0 to 6 months, we're already starting to see some social interaction and engagement. That turning the head towards the voice and sound, watching the speaker's voice, having a social smile, recognizing one person from another, discriminating between strangers and someone they feel comfortable with. So we're already starting to see, as young as 6 months, some of these social skills develop. When we go over to 6 to 12 months, we're already responding to the word no. We are trying to talk, so that babbling is what we're hoping to see. We are seeing laughter. We're seeing playing maybe patty cake or a peekaboo game, which is a back and forth communication. Even though there's no language there, that there is communication. And we can call that a circle of communication, where one person starts something and then we go around to the next person and we're going in circles. So that's a circle of communication already. Distinguishing between friendly and angry voices, responding to facial expressions, extending toys to others, which is really what we call joint attention, where we're engaged in the same activity or with the same object and trying to gain attention by using sounds and gestures and grabbing someone by the hand. Those are all strong social skills that will help develop language down the line. When we're getting to 12 to 24 months, again, our social skills are becoming more complex and they're developing. So we are now doing gestures of waving hello and goodbye. We are repeating actions that make someone laugh. So that again is that joint attention where I did something and we're in it together and you're laughing at it and I'm going to do it again. So that's a mixture of that joint attention as well as that circles of communication. We are again doing verbal turn taking. We are starting to talk to ourselves during play. We're engaging in verbal turn taking. We're naming things in front of other people. Again, these are interactions that are bringing people into our world and engaging socially. Now, I added in, so we've done our milestones up to 2 years old. I've added in what's called pre-linguistic skills. And there are 2 slides of this. And the reason I wanted to put this here is I wanted you to have this information, and there are 11 pre-linguistic skills or skills that toddlers have to master before words emerge. Because for our younger attendees here, when you go possibly to speech therapy, sometimes there are goals right off the bat of saying, Johnny will produce 50 novel words in 80% of opportunities during, well, going on and on. And I get these goals all the time, and these may be with children who have no pre-linguistic skills. So linguistic meaning language. So while I agree that I do want Johnny to have 50 new words or be able to use these words, what I do know as a therapist is that before I get up to that point, there are all these foundational skills that we need to make sure are in place prior to getting there. So really our skills, our goals should be addressing these pre-linguistic skills. And why this is so important is, number one, we want to make sure that we are addressing foundational skills. So we are building upon the skills and can get to that goal, but also important for the family. I don't want you to be discouraged when a few months into therapy, you're saying, well, my child still isn't speaking, but you're not realizing or you're not being guided by the therapist that we may not be being speaking right now, but look at all of these pre-linguistic skills we have gained. And that is very important to know because, you know, to get to every goal, there are incremental skills we must learn. So I want you to know as a parent that it is okay that we haven't gotten to the words yet, but we do want to be making gains with these pre-linguistic skills to eventually get to our words. So some of the skills are reacting to the events in the environment, responding to people when they talk or play, taking turns during interactions, developing a longer attention span. So we don't want fleeting attention, shifting and sharing joint attention with others. And that's what we were talking about earlier. Let's go into the next one. Playing with a variety of toys appropriately. And that's important. Play should be, I want to say functional, but what we're going to talk about Westby's play scale. There are different ways of playing with toys appropriately. We could say, you know, as a speech pathologist, what I'm looking for during play is not just dumping toys out of a box and putting them back in and dumping them again. I want to see, say with cars, some movements, maybe on a track or on the ground, or holding a baby doll, or stirring a pot. So those are appropriate play skills. Understanding early words and following simple directions, vocalizing or making sounds purposefully, imitating gestures, actions, sounds, and then words, using early gestures like the waving and the pointing, and then initiating interaction with others. And that may be like initiating that peekaboo game. So all of these go hand in hand with those developmental skills we were previously talking about. But if you're seeing that your child hasn't developed some of these pre-linguistic skills, this is what I would be addressing at home when you are using everyday opportunities to facilitate language growth, and possibly in your speech therapy. Before I go on, I know that's been a lot of information in a very short time. Are there any questions so far?
Yes, so one of the questions is a question about, are you going to be showing social skills, pragmatic skills, like you're doing a chart with that? Is that coming?
Am I going to be showing social skills?
A chart, yes. Is there a chart or source that can help knowing where our child is as far as pragmatics?
Well, these are all fall under that. These are all social communication skills.
Perfect.
So as we get through maybe older ages, you'll see ones that maybe seem more typical pragmatic skills.
Perfect. Thank you for answering that.
Does that answer the attendee's question?
We will see. So if it doesn't answer it, just let us know in the chat and we will try again. Perfect. Okay, that's it.
Okay. So those are pre-linguistic skills. We're going up to a 2 to 3 year old. Again, they are being refined. They are becoming more complex, these social skills. We're starting to use language for different reasons, for joking and teasing. We are making conversational repairs when a listener doesn't understand. That's a major social skill. That's to be able to see, to look at someone's face and say, oh, they don't understand what I'm saying, or to be able, if they say, to say it again, to be able to modify it and make repairs in your conversation. Participating in some group activities, carrying on a conversation with yourself and maybe with dolls, that back and forth communication. Engaging greater number of turns. So again, that circles of communication, we want those to build and to get to more and more circles of communication. Beginning to recognize the needs of others and being able to speak differently depending on if you're talking to a baby, to your friend, to an adult, to a teacher, to a stranger. That's starting already between 24 and 36 months. And then acknowledging that someone is speaking to you using like yeah or okay. So that's already happening within 24 to 36 months. When we get up between 3 and 4 years of age, we, as far as language, we're already starting to follow 2-step directions. We're taking turns and we're playing cooperatively. We are beginning different types of play, which we call dramatic play, acting out whole scenes. We're showing frustration if people aren't understanding us. And then we're becoming able to express our ideas and our feelings more fluently. And then when we get between 4 and 5 years of age, We're discussing emotions more regularly. Our ability to tell stories has improved. We are using words to invite others to interact with us and to play with us. We're playing some more competitive games. We are using our language to resolve disputes or conflict with our peers. And then we're already speaking of imaginary conditions. So all of these, again, fall under that social communication, and these are ages at which we expect to see them develop. If we have ASD or other developmental disorders, then we may see that these are delayed, or and we can address them through the different types of therapies that we'll talk about. I wanted to put here about play skills, and the reason I did it at the age of 5, they always say up through the age of 5, a child's job is to play, and that is how they learn language. So if you come to do therapy with me, and at my clinic, we use a program called the Family Focused Language Intervention Program. And that is for our early intervention kids, typically up through the age of 5. And the point of that program is that we are going to empower the caregivers how to use everyday opportunities, including play, to facilitate language. So we use a coaching model, but we are on the floor and we are using toys and we are using imaginary play to build language skills. And I always tell my therapists that while we're doing this type of therapy, it is vital that we are explaining to the parents why we're doing what we're doing. Because from an untrained eye, it looks like we're just playing. And a good therapist, it should look like you're just playing. You're having fun because the child wants to be engaged with you and doesn't think of it as work. But we want to make sure that parents understand that while we're playing with the pretend food, we're using skills like bombardment or self-talk and parallel talk or child-led activities, all of these different language facilitating techniques that will build language. So if you see here, anything when you get the this PowerPoint, anything that's underlined is a link. So I've put down for you something called the Westby Play Scale. And Westby is kind of a guru for play. All of the speech pathologists use this play scale. And what it does, it breaks it into stages. And we have stage 1 all the way through stage, sorry, keeps going, through stage 10 here, up through 5 years of age. And it talks about the type of play you're going to see and the type of language skills that go hand in hand with that type of play. Again, it really doesn't matter the ages here. For you, what I'd like to see is, okay, where is your child presenting themselves at the moment? What foundationally do they need to know? And then how do we help them progress through this developmental play skills? So we have something called auto-symbolic play and goes through symbolic play, where a child's extending beyond themselves and they're playing with dolls and they're performing pretend activities. And it keeps going through and through. Say at 3 years old, we're starting to see sequencing in play. We are, by 4 years old, they're doing problem solving during their play schemes. And stage 5, they're planning sequences of pretend events and organizing what they need, objects and other children, in order to play. So this is for you to review on your own time, because there's lots of information here, but it's great information of how you can guide their play while you're at home. The next one, I'm sorry, I'm trying to figure out how to move this. There we go. We have what's called a revised, concise, symbolic scale here. So this goes hand in hand with Westby's play scale here. And it talks about, again, the ages, what you should see here, their theory of mind, what content you'll see, how they're organizing it. and it has it by age levels. And again, it's like a checklist. You can go through and say, okay, I'm seeing this, I'm not seeing this. How do we work on it? A great thing to share with your therapist so you can work together and build play skills, because language is developed through play. Any questions about the play skills?
Not about play skills, but we have a question about like social skills for work.
Okay.
This family member says, I have a 16-year-old non-speaking in the process of independent transition. Please share where my child can get some social skills for internship around work.
So I think I know that if you are through Kaiser, who then works with Easter Seals can work with you to find social skills groups that are appropriate, or Casa Colina, which is in the area, has social skills groups. You can work one-on-one with a speech pathologist as well, and they can devise a therapeutic plan that is very specific to your child and their specific social needs. So those are just some options, but I would look for a social skills group that really is designed for children that are, teenagers with, and really call them and ask them, what is your curriculum? What are you using? I like Jed Baker and Scott Bellini. Let me write those in the chat for you, just so you can see them. Oh, sorry here.
That's okay.
So I put those in the chat. Jed Baker and Scott Bellini, they have both written wonderful books that work on social skills for adolescents. I think there's great information to find in those resources.
That's great. We also had a question about somebody who chronologically is over the age of 20, but it's still developmentally, on a younger play scale. So would you want to take them through that developmental process, even though they're older, or what do you say about that?
Yeah, I mean, I think, like say with our FLIP program, it really is designed for the early intervention population. But if I had a child that was coming to me that didn't have those foundational skills, that needed them and would benefit from that type of approach, I think it's appropriate. Again, when we do something that is typically designed for younger individuals, we have to be respectful of the client that we're working with to make sure that we're respecting their age and their likes. So I think you can bring them through these different stages and have to figure out how to balance that to, again, be respectful. But I think it is, if you have it in mind of how you want to progress and that these do build upon one another and what areas they have not developed foundationally, I don't think it's a negative thing to address it.
Great. And we had a couple questions regarding the recording and the PowerPoint. So we should have those up tomorrow, hopefully tomorrow morning. And somebody wanted to know about, we'll be ending tonight at 7:30. Sorry, lots of questions. What happens if my child with autism has the skills but doesn't generalize them out into the community?
That is a great question. And we see that. So again, I think working, we always say that we haven't truly achieved the skill if we're not seeing generalization across different settings or across different participants. So it really is just working, what we do is we say we're working on something within the therapeutic setting, in a clinical setting, bringing our clients out into a different setting and working with them there, or changing therapists for a day or two to see if we can generalize the skills. So it really is just approaching the task in various settings and working with them. We have to see the reason behind it too. And that's something we're going to talk about really at the end is, it's so hard to say, do they want to use these skills? Is there a way that they can functionally interact in these other settings with using a modified approach to these skills? Those are all things we have to keep in mind. And I wish there was something that I could say that just like, well, this is what you do to get them to generalize. But again, it depends on the skill, it depends on the client, it depends on the situation, and the antecedent or the reason why they are performing specific ways or not performing specific ways.
You know, I think you bring up a great point, Justine, about wanting to use the skills. So I know my own son that even though we had years of social skills therapy, you know, he, you know, would say, I'm an inside kind of person, not an outside kind of person. And he didn't want to talk when he was younger to peers. He didn't mind sharing similar interests, but just conversation wasn't his thing then. Right. Do you have advice for parents who have children that maybe aren't quite ready to take those skills and put them in to practice?
You know, it's so difficult because we have to be, you know, as a parent, and I have an 11-year-old, and I want to push her to be her best and to interact and communicate. And sometimes what we do is try and get them to conform to what society is saying is what they need to do. So you have to smile and you have to go out there and you have to talk to everyone. You have to be social. And is that truly being respectful of their desires and what they want to do? So we have to balance that with, you know, the world is not necessarily at this moment going to conform to all of our children's needs. So how do we get them to be productive members of society and have this interesting life where they get to interact with people and they get to make social gains and enjoy life? You know, it is this balance of being respectful of their skills and where they are and meeting them there with what we want for them. We're going through that with a client right now at our clinic where the mom wants, well, I want him to be just like his brother. And, you know, he's not going to be just like his brother. He's his own unique child. And his brother is not on the spectrum and he is. So is it fair to expect the same exact things from them socially? So I'm kind of torn on how to answer that. And again, that's why I said that everything, we have to figure out what is best for your child and your family and what the expectations are before we make kind of these blanket statements of how to get children to do what we want them to do.
Yes, I agree 100%. Another question, my 3-year-old has speech delay through the school district, but hasn't been diagnosed medically. Is there any recommendations for me trying to figure out things since everything's so new?
Okay, so this is a child then that was tested through the school district and is currently receiving an IEP?
Speech services.
Speech services, okay. And then they're interested in being diagnosed with something additional to a speech and language delay?
I guess that, so I will say that our regional center tends to be a little more conservative than other regional centers when it comes to diagnosing. So if you have a child who does have a speech disorder, you know, how do parents know, in your opinion, to take that next step and what those next steps would be.
So what I would do is, if your regional center, you kind of took the words out of my mouth. I was going to say go to the regional center. Do you work with Inland Regional Center typically?
Yes.
In that area, okay. So I am not vendored with Inland Regional Center, so I don't know kind of how they work. I mainly work with San Gabriel Pomona Regional Center, and I know they have a great developmental team there that can do testing, and we can determine through that, whether your child has an additional diagnosis other than a speech and language delay. The other thing to do is go through your pediatrician and get a recommendation to go maybe through a developmental pediatrician who will have a kind of more focused skill set in diagnosing different disorders, or if you are with different insurances, then say through Kaiser, going to Kaiser, requesting a speech and language assessment, and then requesting testing through their developmental team.
Mm-hmm.
So that's how I would do it.
That's good advice. And Jessica, if you email us, we can also, there's some screening tools that a pediatrician can use, to determine, is it more than, speech issues or language issues, and, their fine motor issues and gross motor issues and behavioral issues. And so, yeah, you can look at some of those other developmental milestones. I mean, Justine's just touching on not just, but the speech and the communication, social communication piece. But there's other development, especially for an autism diagnosis, that would need to be affected. Here's another, and we see this a lot too. Here's a question. My son wants to use the skill, but has a hard time expressing himself and gets stuck and doesn't know what to do. Would that be underlying issue related to language? And can you talk a little bit about the processing piece of this, right? So we know that we have kids and adults that have the skills. We've seen them use the skills, but under stress or in a more crowded environment, all of a sudden the processing becomes much harder.
Absolutely. And that is something that I would work hand in hand with the speech pathologist to address, because there's different, is it acquisition of knowledge difficulty? So we haven't acquired the knowledge yet, or can we not perform? So performance issue. So if we have the knowledge but aren't able to perform, then working with the speech pathologist, or in a social skills group to work on those specific situations and have therapeutic techniques or compensatory strategies that we use when we do get stuck. That's how I would approach it. So doing scenario-based activities of and speaking, really working collaboratively. So working with the client, working with the family members, where are we seeing this happen, and then figuring out, okay, these are strategies you can put into place in order to, help you get through these events.
That's great. Can you talk about spell to communicate?
I'm sorry, spell to communicate?
Spell to communicate. I didn't know if that was an app. That was one I didn't know. So have you heard of that one?
I'm sorry, I don't know that.
I don't know that one either. All right, so you're gonna have to give us some more information, because I didn't know that one either. I thought I was just out of it.
No.
Here's another one I don't know. So is it still mandated by for facial coverings? So the question is, if there's a mandate on facial coverings for speech pathologists, how is a child supposed to learn about facial expressions, and is that interfering with being able to teach communication skills?
So currently at our speech clinic, it is still mandated to wear facial coverings because we are considered a medical clinic. So what we've done in that case for our clients who really would benefit more if we didn't have the facial coverings is we are doing teletherapy, or if a client is unable to wear a mask, then we're wearing face shields. and working with the clients that way.
To get around that, that's good. Okay, this is something we see as well. So I loved your slide that you had social communication broken into like those 4 buckets, right? And sometimes we hear that students don't qualify in one of those buckets, but they, will do the social skills to address the pragmatics. And what advice would you have for, families that are concerned about those other buckets, but they're not getting services in those? I don't know necessarily, and I'm thinking more like in a school setting, is that, does there have to be a necessary gap in between what developmentally appropriate, speech services would be for not necessarily the articulation, but like the morphology and that kind of testing versus pragmatics? Does that make sense?
So we're asking if they're getting services within a school system, would we have to see scores below the standard score of 77, which is usually that's 1.5 standard deviations below the norm, and that's usually the scores you need to qualify. Would we have to see deficits in language processing and pragmatics for them to be getting goals in both areas? Is that the question?
Well, so you're okay, so let's keep going about the standard deviation. So is that the same qualification in a medical model that it would be in a school model? Would I have to be that far behind to get speech services in a medical model versus a school district?
So the medical model is its own beast. We sort of walk the line of this medical model on a daily basis with our insurance companies, because what we think of as pragmatic skills, and that, oh yes, a speech pathologist should absolutely be able to address these areas, actually fall under not speech therapy, but under like a social skills group under some medical models. So when you go back to those 4 different areas, we can address some of those in speech therapy and not other areas. And it depends who your insurance company is and how closely they're looking at your goals. And again, it also depends on which insurance company, of what their requirements are for qualification. So I know that's not a specific answer, but Kaiser and Easter Seals will have one set of qualifications versus Blue Shield, Blue Cross.
Yeah, no, and it's a real answer because, one of the things we talk about is, the educational model versus a medical model, and that, there's different goals that they can cover. There's different qualifications. So you may have to go back and forth between the different types of models to make sure you're getting all your needs met, or all your child's needs met.
Absolutely. And what I hear from parents a lot is, am I able to get medically based coverage through Blue Cross, Blue Shield, Kaiser, Easter Seals, if I'm getting school coverage as well? And absolutely, they're 2 separate entities.
Yes.
But what I do hope is that all of your therapists are working collaboratively, so we're all on the same page and we're treating your child holistically. So we're not teaching a different therapeutic technique than the school-based SLP and confusing the child.
Tina sent me the link for spelling as communication, and I am not familiar with them, Tina. So I will send this over to Justine later and have her take a look at it, but I have not heard of them. So thank you for sharing that resource. So what about older clients? Let's say, there's somebody who's already aged out of the school system, but let's say they're minimally verbal. They don't have a lot of communication. Maybe they do need augmentative communication, or maybe they need social skills. Do you find that insurance tends to fund for the ones that are older and out of school?
Do you know, well, through regional center, they will often have them go through a social skills group or into a day program. Through Kaiser, they see their adults in-house, so versus sending them out to their vendors like myself. So I don't get the opportunity very often to work with adult clients, which we would love. But I think if you can indicate the need for a specialist in, say, augmentative alternative communication like AAC, then you may have a better chance of getting those services, or a specific kind of therapeutic program, social skills program.
Great. Okay, let's see, how are we doing on time? Probably horrible because we're asking a lot of questions.
Well, I'll go through this quickly. What I put here, just more stages of play for you. And then really when we jump from like 5 to 11 years old, there's not a lot of those developmental norms that I was giving you where it's breaking it down. But what it is doing, let me just make that a little bigger for you, is showing these are the some observable behaviors and social skills that you will see between 5 and 11 years old. So, and they've broken it down into what I like, the introducing communication and responding to others. So that's where we're selecting and introducing topics, we're maintaining and changing topics. Effectively, we're sharing and adding information as someone else is speaking. We're initiating conversation, we're responding to others, and then we're repairing that broken conversation. That is something we should be seeing between 5 years old and on. That nonverbal communication. So how to, again, this is always how to do it expressively. So how to show facial expressions as well as how to understand or comprehend others' facial expressions. Again, with body posture.
Okay, I think we lost her. I thought it was my internet. So let's wait and see if she pops back on. I was just checking my internet. I know, my worst nightmare in the middle of a presentation and you lose your internet connection. Let's see. Yeah, my screen froze too while she was talking, but again, I thought it was just me. So we will wait and give her just a second and see if she pops back on. Good thing you guys are so nice and accommodating. We appreciate it. And I really appreciated Justine. She has a lot of great information. She's been around for a long time, wonderful reputation in the community. So I appreciate that she had a lot of handouts that we'll be sending out to all of you as well. She's been great. Let me see if I got all the questions while we're waiting to see if she pops on or not. I know somebody had asked about what time we're going to be sending it out. It depends what time I'll get the presentation back from her. If I get everything I need tonight or first thing in the morning, then we can get it out as soon as possible. But sometimes it takes the speaker a little longer to get us the information. So we will wait and see. Yes, stupid Wi-Fi. I agree. Sometimes Wi-Fi is stupid. Do you guys have any other questions for while we're waiting? I know we only have like 5 minutes, but I thought she was awesome. Yes, it is hard to find support groups. And that's one of the things as we're looking at, you know, how do we kind of go back into a hybrid? You know, online groups have been good for some people and in-person groups are good for some people. And, you know, can we continue to offer both as we start to get into a little safer environment? I will announce to you guys while we're waiting is that we found out today that we received a grant. Oh, here she comes. We received a grant and we'll be offering peers social skills training this summer with UCR. So look for information on that. And there she is. Welcome back. Let's see. Did we lose you? We may have lost her.
Can you hear me?
Oh, now I can hear. There you are.
I'm plugged in.
Oh no, you froze again. Justine, are you there?
I'm here.
Oh, there you are. You froze again. You know what? Why don't you try turning off your camera and let's see if we can do your PowerPoint.
Okay, let me get on to share screen.
Yeah, let's see if that helps at all.
Okay.
I know we just have a few more minutes, but that's the way technology goes sometimes. Yes. Perfect.
Okay. Can you see my screen?
We can.
Okay. So again, I know we don't have a lot of time. Oh no. Am I still on?
You are.
Okay. Sorry. I thought I got knocked off again. We don't have a lot of time, but the information is here for you. So this is talking about, again, pragmatic language skills that we should see, you know, as adolescents. And what I put here is for adolescents and social communication.
Justine, I think we lost you again. I think we lost her. Okay. Oh, you can hear us, but we can't hear you. Of course. See, you're so popular. Everybody's already asking if you can come back again. Okay, well, let's just say that we lost to the technology. We can see your presentation, but we can't hear you at all. How about we'll call it for tonight. We'll send out your fabulous presentation and your resources, and we will ask if you would be so gracious enough to come back another time. Don't be sorry. This has been great. I know you were able to answer a lot of questions. So thank you so much, Justine, for the great information and be so willing to answer everybody's questions. I know everybody, I'll speak on the behalf of everybody. We really appreciated your honesty and your candor and being able to get some of the questions answered that are tough. So thank you for being that voice out there. We appreciate it. All right, everybody, I'm going to call it tonight. Let you have the rest of your evening. And thank you again, Justine, for tonight. We're sorry the technology wasn't working. And have a wonderful, wonderful evening. We will send this out and everybody take care, stay safe out there, and we will see you next time. Bye, everyone.